Everybody, it's Laura. I wanted to update you guys about the medication administration simulation because I feel like that first video was very inadequate. So I'm going to start over kind of from the beginning and talk about, let's just start. First of all, we're going to start early next week so that we can get all of the students in and get through. So please remember to look at the schedule, which I am kind of showing here. Notice that we are going to be in the high fidelity simulation lab on the adult side. Right now, that's all that I know. And the last conversation that I had with Rebecca and Eric was that we would be on the adult side. So I think that that is still true, but I have no idea what rooms we're in. And I probably will not know until Tuesday morning. Eric and Rebecca are juggling. Every single level is doing med administration simulations next week. So they are trying to juggle where they're putting all of us. So it's all still up in the air right now. I just know that we will be in that lab on the adult side. So as you can see from the schedule, we've got rooms that we are assigned to, and in those rooms will be one pediatric patient and one adult patient. The rooms are probably going to be set up with the beds kind of up against the wall and the IV pumps in the middle. That will give us the best access to all the things that need to happen. And then the medications themselves will be on the counter, as we've talked about before. So that will be like the med room, and then where the patients are will be the patient room. You can see on Tuesday we've got 4 rooms going. The rest of the week we have 3 rooms, but that 4th room is going to still stay set up so that we can use it for remediation and repeat if we have any students that need to repeat. And I will talk about that a little bit more in just a minute. So let me just tell you, in the patient rooms, so we will have one senior 1 faculty member and one senior 2 faculty member working together to evaluate. So we have 4 sets of eyes evaluating the student pairs as they come through. And you will have the same, patient set in your room all day. I will tell you, so again, I don't know which patients will be in each room yet until that gets set up next week. What I can tell you is, like, the Peppermints are together, the Browns are together, the girl Van Pelts are together, and the boy Van Pelts are together. So at least when you're looking at the key, you can at least put those things together. What you need to know about the key is that you have all the information you need on those patients to determine what meds should be given, how much of those meds, how many mils of those meds should be given, what the dose is, what rate it should be running at, and things like that, so you can verify that as the students are administering the meds. The faculty, for us, we won't be using the, this is a static situation, so the patients will not, their vital signs won't need to change or any of that. They'll have all of that in the chart. So we're going to sit outside of the rooms. I think it will be easier for us to evaluate the students and the situations if we're just sitting outside of the rooms watching, as opposed to trying to be in the control room. And so we'll be watching there. We won't be doing any cueing. We won't need to speak for the patients or the parents. They're not going to be talking back or anything like that. If there's any cueing to be done, that will be coming from the S2 student. That's kind of the expectation of them playing that role of preceptor. Let's see. Also, we've got several float people coming in. That's what these people over here highlighted in yellow are. They are people who can come in and kind of float in order to offer us some like breaks, so that you can take a break, grab some lunch, do things like that. And also, so I talked about the fourth room. So if we have any students who need to do remediation or to repeat, our plan is to use that fourth room setup so that students can come in, remediate. And what we're going to do is, instead of using our time to remediate them and repeat their simulation, we're going to have them videotape their simulation. So they can do it as many times as they want to, and they can videotape themselves doing the simulation, and then we can watch them later and give feedback and see where they are. And if it's still bad, we can then determine if we need to bring them back in. But we can also use these float people to help with remediation and kind of monitor that situation if we need to. So that's how we can use them, as well as, you know, giving people breaks and things like that. Okay, I think that's that. So let me talk just a little bit. There is a video that's already posted. I think it was posted in week 2, maybe week 3. I don't know. I think maybe week 4 as well. That walks through how the sim should go. It was posted for the students, as well as y'all are welcome to watch that. So it does a kind of a demo of what the sim should look like from the pediatric perspective. At the time, we didn't have the adult stuff ready. Alex is going to do a video from the adult sim, and that should be ready to be posted tomorrow. But let me walk you through it just very quickly. For the adult portion of this simulation, what the students will do is the medication infusion will already be going, and the students will just come into the room. Hi, my name is student nurse. I'm going to be giving you, just going to be checking your medication infusion, do my hand hygiene. Can you tell me your name and date of birth? I'm going to scan your armband, and they're going to verify that with the MAR. And then they're going to then check the medication that's hanging, and they're going to scan that, and they're going to narrate, this is such and such med that's hanging. That is correct. Here's the dose that it is. Here's the time. Here it's hanging IV. And they're going to verify their 5 rights with the MAR after they have scanned, or as they're scanning that. And then they're going to say, okay, my vital signs are, here's my heart rate or my blood pressure, whatever it is, that depending on what the med is, to indicate that, yes, I need to change this medication dose. And they will have done their calculations, and then they will set the pump to titrate it, and then they'll document in the EHR tutor what they're changing the rate to, and then they'll change the rate on the pump, and we'll verify that that's correct. And that's all they have to do in that piece of the simulation. They have 45 minutes to complete this whole simulation, and then you'll use your MASSET to give feedback once that's done. So let me then talk to you a little bit about grading. So the MASSET is the tool that we're going to use to do that, and this is what that looks like. It's this 20 item thing. Each faculty member, S1 and S2, will have a copy of this. If one of you has a computer, you can already open it up into Canvas and use the MASSET in Canvas, and it'll directly already put this into, sorry, excuse my scrolling. It'll already put the grade into the student's grade book. That will be a really efficient way to get that done. But what you'll do is each of you will complete the MASSET, and then at the end you'll compare, okay, here's what I got, here's what you got. Okay, you said a 1, I said a 0. Let's talk about this and come to a consensus as to what the score should actually be. That will be the score that will get entered into Canvas. And the reason why it's important to put it in Canvas is so that this will be available to the faculty of record, so that this can then be converted into the CET. And that's the score that the student will have to be, I'm going to say graded, if you will. And I'm going to show you how we're going to do that. The other thing is, so the Masset tool itself, this is the score that's going to determine whether or not they need to do remediation and repeat. So if they make less than a 14 on this tool, those are the students that will need to have remediation and to repeat, go in that room and do all the do the remediation, and then videotape themselves doing it again until they get it right. So this document right here, which I will share with all of you, shows you how the Masset correlates to the CET tool. And so this is the CET. We're all familiar with this. This shows you what numbers on the Masset correlate with the items on the CET and how to rate those. So, like for example, obtains pertinent data. That corresponds with the items where they're checking allergies. So if they don't check allergies, which is number 4 and 10 on the Masset, and you can look in Canvas. So like you would just look at number 4, did they get a 1 or a 0? If they got both zeros or even a 1 and a 0, then they would get a 0 on their CET. And so you would just walk down these and see which items these correspond to, and that will tell you, do you score a 0, a 1, or a 2 on the CET. Some of these items, like this one, for example, isn't on the Masset, but we did put it down here at the bottom of the rubric in Canvas so that all of these scores would be here and easy for you to access. Okay, I think that's all I have to say. If you have questions, please let me know. Thanks.